with our GMA cover story, a health alert about exercise. A new study finds that doing a variety of exercises adds benefits to your long-term health, even more than how much time you spend exercising. And our chief medical correspondent, Dr. Narula, is going to join us to break down this study. We're leaning in.
All right. Well, we all know that exercise is good in terms of reducing your risk of developing chronic diseases, for your mental well-being, and for your longevity. But the question, Robin, is, are there particular activities that may work better in terms of helping you prevent premature death or aging? And so researchers looked at that question. They looked at over 100,000 individuals followed for 30 years, and they asked them about their physical activity with assessments every other year. They asked them, for example, how often last year did you walk? Did you jog? Did you cycle or swim? Do gardening and yard activity, all kinds of activities. And they essentially found exactly what you said in the intro, which is that regardless of the total amount of time that you exercise, the higher your level of variety of exercise, that translated into a 19% reduction in premature aging.
Wow.
In particular, when they looked at specific types of death, so cardiovascular mortality, cancer death, and respiratory death, that high variety resulted in a decline of about 13 to 41% in those specific types of deaths. So really a lot of benefit to potentially, mixing up your routine.
So mixing up is good, but are some exercises better than others?
Right. So most of the exercise they looked at actually had benefit. And when they broke it down, really, George, walking was the best. In addition to walking, they did find that tennis, squash, racquetball,
2 for 2, Robin.
As well as running, calisthenics, and rowing seemed to be the best. In that mid-level range, in terms of a little bit less benefit, was jogging and bicycling. And then the least, in terms of no real benefit, was swimming. So I don't know if any of you are swimmers, but that did not seem to translate. Exactly. So, important to think about that if you're trying to figure out which things you might want to work in. And I will say weightlifting, which we were just talking about, actually was in the same category as walking. So definitely higher benefits.
Higher echelon. Sam didn't seem happy about swimming.
No, because
Are you
I'm
a
like,
swimmer?
swimming should be great. I do enjoy it. And I think it's helpful.
Pictures of you in your gear.
Yes.
Let's move on.
Let's move on. Definitely let's
We don't have
move
a picture
on.
to show of you in your
No,
gear.
we don't.
Okay.
And if we did, we shouldn't show it now.
At Sam Champion.
But we have, we've all heard what they say, 150 minutes of moderate exercise a week.
Yeah.
So with this new study, what do we know now? Are there anything you would change as a cardiologist and suggestions?
I would not. So the recommendation still stands: 150 minutes a week of moderate intensity cardio, or 75 minutes a week of vigorous intensity cardio. But really what you might want to do is, again, think about mixing in a little bit of variety. So maybe some yoga with your walking, some gardening, even digging outside in the yard. All of these things put together might translate into better outcomes. So as the 18th century poet William Cowper said, variety is the spice of life. It might also keep you alive longer.
Wait, so moderate means you can still talk while you're doing it,
Yeah,
basically?
I usually tell people you can still have a conversation if you're like walking with someone or exercising, whereas vigorous, it's really hard to have a conversation.
Wow, okay.
Great information.
Mix it up.
Mix it up.
Mix it up, that's right. All right, Doc, thank you. We appreciate it.